We will discuss enteroviruses, their signs, symptoms, severity, and treatment. When people experience cold-like symptoms during summer, they commonly attribute it to enteroviruses. This is partially true because enteroviruses indeed cause symptoms such as sore throat, fever, runny nose, and diarrhea. These viruses thrive in warmer weather and are easily transmitted through swimming pools and beaches. That is why they are associated with summer flu and summer cold. They are called enteroviruses because they primarily infect the intestines, though not exclusively. Enteroviruses are a large family of viruses consisting of more than 70 different species. However, when we refer to enteroviruses, we usually mean Coxsackieviruses or echoviruses. Among them, Coxsackieviruses are more common. In adults, they typically cause respiratory infections that resemble cold. The main symptoms include sore throat as a first symptom, mild fever after it, and runny nose, fatigue, and muscle ache. They can also cause diarrhea, nausea, vomiting, and sometimes stomach pain. When these symptoms occur, it is commonly referred to as the stomach flu or stomach bug. In some cases, enteroviruses can cause painful ulcers in the throat and mouth, along with fever, a condition called Herpangina. However, Herpangina is rare in adults. In rare cases, serious complications in adults, such as myocarditis, which is inflammation of the heart, or viral meningitis can occur. In children, enteroviruses cause hand, foot, and mouth disease. This disease causes a rash on the skin and inside the mouth. The rash may start as red spots and develop into blisters, particularly on the hands, feet, and mouth. These blisters usually heal without scarring after about a week, though sometimes they may last longer depending on the severity. The rash is often accompanied by fever, sore throat, and sometimes a reduced appetite or irritability in children. The child may also develop painful sores inside the mouth, making eating or drinking uncomfortable. Hand, foot, and mouth disease is caused by Coxsackievirus A, while Coxsackievirus B is more likely to cause diarrhea, vomiting, and cold-like symptoms. A distinctive feature of enteroviruses is gastrointestinal symptoms such as diarrhea, vomiting, and abdominal pain. While these can occur with a common cold, they are more characteristic of enteroviruses. Fever, which is rare in the common cold, is more common in enterovirus infections. Enteroviruses also tend to last longer, around 7 days, compared to the common cold. Another important enterovirus causing flu-like symptoms is Echovirus. The symptoms of Echovirus infection are similar to those of Coxsackieviruses, but starts more gradually with mild fever and sore throat. This is followed by either diarrhea and vomiting, a runny nose, and other respiratory signs. Echovirus commonly associated with gastrointestinal symptoms alongside with respiratory symptoms. The most serious risks associated with enteroviruses are viral meningitis and myocarditis, which is inflammation of the heart. They are related with Coxsackievirus. Both conditions are usually self-resolving and are not common, but they require immediate medical attention and hospitalization. There is also some evidence suggesting that Coxsackievirus may increase the risk of type 1 diabetes in predisposed individuals, though this connection is not well established. Now, regarding treatment, while there is no specific antiviral treatment for enteroviruses, supportive care is important. For pain and fever, acetaminophen and ibuprofen are commonly used. Calamine lotion, aloe vera gel, or hydrocortisone cream can be applied to relieve skin rash and discomfort. For mouth sores, a mild saltwater rinse can help reduce pain, promote healing. Baking soda mixed with water can also neutralize acids in the mouth and soothe the discomfort. Adequate hydration, rest, and recovery are essential to support the body's immune response. To avoid enteroviruses, frequent hand washing with soap and water is recommended. Avoid close contact with infected individuals as the disease spreads via respiratory droplets and contaminated water. Teach children and adults to cover their mouth and nose with a tissue or elbow when coughing or sneezing to minimize respiratory transmission. As for supplements and foods recommended during enterovirus infection to shorten the duration of illness, honey can soothe the sore throat. However, honey should not be given to children under 1 year of age due to the risk of severe bacterial infection. After 1 year, honey is safe for all age groups. Ginger tea has anti-inflammatory and antiviral properties, helping to relieve nausea, sore throat, and body aches. Drinking ginger tea with a bit of honey can be an ideal combination. Garlic has immune-boosting properties and antiviral effects. Adding raw or cooked garlic to food is a good idea, or you can take it as a supplement. Vitamin C is also known for its immune-boosting effects. The common recommendation is to take 500 mg to 1000 mg per day during an illness. Zinc supplements can also shorten the duration of symptoms caused by enterovirus. Zinc lozenges are particularly effective for sore throat. Typically, 15 to 30 mg per day are recommended during infection. Echinacea is a popular herbal remedy that improves immune system function and reduces the duration and severity of infection. It is usually recommended to take 300 mg 3 times per day. Probiotics also play an important role, especially in cases of enteroviral infection, where diarrhea and vomiting are major symptoms. A high-quality probiotic supplement, particularly one containing Lactobacillus rhamnosus, is most effective and well studied. It supports immune function by promoting antibody production and enhancing the body's defense against viral infections. Incorporating yogurt, kefir, or fermented foods like sauerkraut into your diet can also be helpful.